Hi, everyone. Welcome to Nurse 342 Clinical Thinking in Nursing. My name is Dr. Kate Stiller, and I'm going to facilitate the course for you. Today, in this video cast, I'd like to just tell you a little bit about myself and give you some guidance in moving through your first week of the course. First off, my experience is in adult medical surgical nursing and alternative health care. I've earned my bachelor's and master's degree at Edinburgh University and was very pleased with being able to attend a local university, much like many of you are. I also went on to school and traveled 2 hours every day of class to Cleveland to attend Case Western Reserve University Francis Payne Bolton School of Nursing. I earned my PhD. When someone earns a PhD in nursing, they do so that they can teach in academic institutions and so that they can complete research which builds on the science of nursing. So you'll hear me refer oftentimes to the science of nursing. When you do research, you uncover new knowledge that helps to build your science. If you have a PhD in chemistry, that helps you to build the science of chemistry. Or biology, you build the science of biology. I have a PhD in nursing. So my focus is human beings and taking care of human beings in all different settings and studying how to have the best outcomes primarily. So that's my background. I am a busy person just like you. I have a family at home. I have 3 adult children who are all in their 20s trying to get started in life very much like some of you are. One of my sons is a social worker, another is a LPN, and the third doesn't know what he wants to do yet. So we'll see what happens. I have 2 dogs and a husband, and I live in Erie, Pennsylvania. I am much older. I have 26 years of experience in nursing education, teaching at Edinburgh University, Clarion, Gannon, the University of Akron, St. Vincent School of Nursing. So some of you may have seen me out in the clinical setting, or you may have even been taught by me before. So it's exciting to have you in this class. I noticed some of your names I've taught last semester. Last semester was quite a semester for me in that unfortunately I lost both of my parents with whom I was taking care of, and I had to have emergency surgery as well. So it's kind of chaotic. So let's hope that this semester is a better one for me and for all of us. I'm very excited to be teaching this course because this course is about thinking and learning how to think better. And thinking is something that we all take for granted. So it'll be interesting to learn what we don't know. So, as I said, let's move forward now, and I'd like to give you a little introduction to the course and to the content. And that's my primary goal today. So the course is entitled Clinical Thinking in Nursing. When I saw this, I was thinking, well, what's clinical thinking? I've heard of critical thinking, but what is meant by clinical thinking? And I was sure that a theorist developed that terminology. And basically, clinical thinking involves using critical thinking to solve clinical issues and clinical problems. So our goals for this little lecture, my goal is to orient you to the Nurse 342 course. But of course, you're going to do that. You're going to orient to the 342 course. Hopefully, you'll be able to describe what is meant by clinical thinking skills by the time we get done today. You'll be able to note that Patricia Benner is a big driver of this course in terms of a lot of her theory as it relates to clinical thinking. And she is a nurse theorist, by the way. You'll be able to define all major concepts that we're going to explore in this course, including critical thinking, clinical thinking, creative thinking, decision-making, problem-solving, ethical reasoning, and metacognition. So I think with most of those terminologies, you could probably describe them off the top of your head with the exclusion of perhaps metacognition. That's not a term we use in our everyday language. So those are our outcomes in addition to just introducing yourself to your classmates on the discussion board, getting to know each other. And that's one of my objectives in videotaping this short little lecture, is so that you can get to know me and know that I'm someone that you can come to with questions, and I'm not going to be rude or arrogant. I'm going to answer your question and try to steer you in the right direction. So I'm in education because I care about my students and I want you to learn, and I work very hard towards that. So I would never want you to be out in cyberspace lost. So the easiest way to get a quick answer is to simply email me at cstiller, CSTILLER, at clarion.edu. And if you're really in a panic, you can call my cell phone, which I have listed under instructor information in our course. Now, please, when you email me or call, tell me which course you are in right away. Say, hey, Dr. Stiller, this is Kate Stiller from NUR 347, Clinical Thinking and Nursing. I have a question about our assignment in week number 1. I'm not sure about such and such, and be very specific. So it's important to give that background information when you call, because I do have 3 courses running at once, and I have a lot of outside committees and obligations and people that I'm working with. So I may not know who you are unless you give it. It's just very helpful and caring to give me that background information. Finally, our final outcome is to discuss the value of cognitive knowledge, professional knowledge, and internal and external factors that will affect your thinking. So, we have cognitive abilities. Some of us are better at analyzing than others, and, other general cognitive processes. Some of us have more professional knowledge than others because we have more experience, we've done more reading. For example, I've done an extensive amount of reading because I've been around. And also, by the way, I've practiced recently working on 7 South, on oncology unit, and med-surg unit at Hammett UPMC, also the oncology unit at St. Vincent's, and fast track of the ER at St. Vincent Health Center. So, just only a couple years ago, I went back to clinical practice and revisited. So I wanted to see if nursing had changed that much. And really, quite frankly, it hasn't. The technology is new and different, but nothing I haven't been working with as a professor in clinical. So that's that. So let's move forward. So let's talk about orienting to the course. Every instructor has things set up just a little bit different. And I think it would be nice if we had greater consistency between instructors. But what I would recommend to you is to go and print off your syllabus and your course calendar so that you can have it in written form, so that you can quickly access it when you're trying to see what's due each week. I would take all the due dates for all of the assignments and put them in your calendar, whether it's on your iPhone or whether you have an actual written calendar, and explore your course assignments. In this class, it's a brief class. It's 7.5 weeks long. So I have 2 short papers for you to complete and a number of discussion board assignments. And those discussion board assignments are assignments. They're not just a time to chat. They're a time for you to show everybody what you've learned, what you've pulled out from your readings, and to reference those readings and other readings that you may have explored. For example, we're going to talk just a little bit about Patricia Benner in this first week. You might want to go to a nursing theorist website and see, all the details about her theory, and you might share that. This is just an example. So then you need to include your references. You need to jot down your references so that you can include them on your discussion board assignment. So I'm working on the requirements for the papers right now. This book that I've assigned to you is new. It's very hard to find textbooks on clinical reasoning and thinking that aren't too expensive. So I did locate one. I like it very much. It is not an easy read. Thinking is a complex topic, so you'll have to take your time with your readings from your textbook. You might need to make notes in the margin. You might need to ask yourself periodically, what is my takeaway from these 2 pages that I've just read? And those are the things that you want to bring forth in the discussion board. And also in your papers. When you do your papers, I'm going to ask you to apply what you've learned from your textbook. So I've sent you an email telling you that it's imperative that you buy your textbook because I am going to use it as the main guidepost for learning in our course. I'm not going to include as much outside reading because I think you're going to have enough to do to read and understand and apply and synthesize everything that you've read in your textbook each week. We will have that book read by about week 5. So in the later weeks, you might see me assigning some outside reading, but generally we'll work from your textbook. In addition, I may use some YouTube videos because I think YouTube videos really make the content come alive. It is difficult to find the perfect YouTube video, though. So that's always a challenge. But that's something I might include as well. I'd like to do that. So the way I have this course set up is I'll have your course documents, which is the syllabus and the course calendar. The course calendar has all the due dates for your assignments. This course actually runs from Tuesday to Monday, and I have to look at my calendar that I have right here. This is what I'd like you to run off. And so most assignments are due Monday night by 11:59 if they're assigned during that week. So I've tried to be clear and designated the exact date. For example, week 4 runs from 2:14 to 2:20, and your reflection paper is due 2:20 by 11:59 p.m. So I haven't waited until the end to have all your assignments in because I want you to know how you're doing. And there's guidelines for discussion board. You need to have your initial post up by Friday at 11:59, and you need to respond to 2 peers on 2 separate days by Monday at 11:59. So in this way, we have some discussion going throughout the week and not just all at the tail end. That's kind of useless. We need to make use of every day. So if some of you are early birds, I very much appreciate that because you're going to get the discussion going early on, and that will help the whole class. This helps the class learn too. It helps you to learn from what you're reading by applying it in a discussion, but you'll bring out points that other people will have never thought of on their own. So I believe that we have a responsibility not only for our own learning, but for the learning of others in the class when we're doing discussion work. That's a type of group work, really. So you'll see there'll be a rubric for your papers and for discussion board. For all assignments, I urge you to be very clear in your writing and explanatory. And this is kind of a style requirement that's reviewed in your APA book that I believe you've bought previously and learned previously, some of you from me, how to write in a technical way. And, you're not trying to be a drama queen or king. You need to just be very clear, explain what you're talking about, what meaning it has in answering the questions of the assignment, whether it's a discussion board assignment or a paper. Now, on the discussion board, we can be a little more informal because we want to be real. So you'll see me using everyday language when I talk to you here and also in discussion. I don't want it to be stiff, but we still need to apply theory in that discussion and not just say, hey, yeah, this is what I've seen on my unit, and yeah, I agree with you. Way to go, John, for your post. That's wonderful. That's called an attaboy response, and I've been in courses and I've done that before. That's when you don't have time to actually do the assignment. You're trying to just get your mark on that board without saying anything. Well, you're not going to get a very good grade if all of your responses are like that. You can have those responses in addition to having a very scholarly response, which is remarking on readings or internet sites that you've looked at that relate to the content of the week. And that's called a substantive remark. And then applying that theory to everyday life. Yes, you can say, I've noticed that some nurses are dumb bunny nurses. I use that terminology all the time, dumb bunny nurses, meaning they don't think about what they're doing whatsoever. They're en route. They're just moving. They're task-oriented, and they're dangerous, by the way. So we always need to be using clinical thinking. And we need to do that in our discussion board postings and also in our assignments of papers. So if you ever have any questions, please let me know. When I start grading your discussion board, I might give you comments like avoid drama, be specific and explanatory, be more comprehensive. You only have 2 sentences in your post. That's really not going to help anybody much. Those kinds of things. So those are my suggestions for both discussion boards and writing high quality papers. Make sure that you're answering the question and not talking around the question. And that's being specific. That's a part of being an educated individual or a nurse scholar. My instructor information is posted. Email is best. I check. I'm kind of addicted to checking my email unless I'm out of town or at a conference. I check it. I'm on the computer all day long normally. So that's kind of the nature of being an online professor. As I said, be certain to introduce yourself when you contact me. So that's the introduction to the course. Now I'd like to just introduce you to the overall course content. And what I did was, get your syllabus. Here it is. Take a peek at it. It has my information, how you can reach me, what my office hours are. They're Monday and Thursday, 2 to 4, and Wednesday, 5:30 to 6:30. A general course description is here. Our textbook is listed. It's clinical reasoning for the health professionals. I have the ISBN number. That number helps when you're trying to track this textbook down. There's learning outcomes, and they seem kind of vague to me sometimes, like differentiate among skills in the thinking domain. That could be a lot of things. Recognize thinking as a diverse concept. What does that mean? Now, then as you get in the content, you can see there's thinking in nursing. What is thinking? What is better thinking? Consequences of better thinking, responsible thinking. Once more, very broad kinds of information. But then there's concepts like creative thinking, decision-making, problem-solving, metacognition, Metacognition. What's that mean? So we're going to explore all of those terms and define them very quickly today, just as a jumping off point for the rest of the semester. But you'll notice as soon as you start reading, your textbook gets into substantial detail about some of these concepts. And that's why you must read. So let me throw this question out at you. And unfortunately, we're not in a real classroom. I'd love to pick your brains, but I'm still going to pause and ask you to really think about the questions that I ask. Why learn about thinking? Who cares? We all got brains. They're working. We're thinking all the time. Are we? Are we thinking all the time? Well, I find working in clinical practice exhausting because I am thinking all the time. And I'm oftentimes thinking, what is the worst thing that can happen to this patient? One of my latest patients that I had, I just came in the morning, and this gentleman had an esophageal varice repair, and he was in liver failure and was threatening to vomit. He just had a surgical operation on his esophagus 2 days prior. I know, I always think pathophysiology because I spent a lot of time teaching pathophysiology. I know that the liver plays a part in clotting. And if your liver is failing, you're not going to be clotting like you normally would. I also know that having surgery on an esophagus and then vomiting would put a lot of pressure on the esophagus surgical site. So that if this man started vomiting violently, he could open up one of his surgical incisions in his esophagus and wouldn't clot, and he could die. And he was only in his 30s. Oh my goodness, what a disaster that would be. So I really see, getting an order for Zofran or some other antiemetic as being imperative. Like one of the first things that I would do that day. Now, if I didn't have all that professional knowledge, that's professional knowledge that I'm talking about, that pathophysiological knowledge, I may not be as concerned. I might be that dumb bunny nurse. I'm thinking, oh, he's nauseous. Oh, that's too bad. Well, I'll get to that when I can. But I got to get all my assessments done first. So that's just an example of how important it is to be a good thinker. And some of the reasons I listed, I think better thinkers are better practitioners of nursing care. What kind of thinker are you? How much professional knowledge do you have? Better thinkers save lives. I could save that man's life because he is an experienced nurse who knows it's very important to not allow him to vomit. I could save his life. And research has shown, and I saw something about this in the first 3 chapters that you need to read this week, that when nurses are better thinkers, that they actually save lives. Nurses who have more experience, more knowledge, have better outcomes. We can all become better thinkers. We can all gain more knowledge. We can all learn questions that we should be asking. What, where, how, why, what for? Why is this happening? What don't I know about this situation? Etc. So I'm hoping that I can teach you some of these tricks as we move through this class. We'll know quite a bit about how we think and how we can think better by the end of this 7-week session. I imagine I'll learn more myself after reading through this textbook, which I have never read before. So, just as a side, please bear with me as I work through presenting this course. I'm going to try to stay 2 weeks ahead of you, and I'll definitely have guidelines for all your assignments up front. But as far as posting information in the course, you'll just see 2 weeks ahead. So by dissecting important aspects of how we think, our awareness will be increased and our thinking will be improved. So we can reset our minds. We can become better and better. And that's kind of one of my credos is, become better and better every day. Don't stop. Don't stop learning. Okay. So clinical thinking, what the heck is that? Well, see Chapter 1. Chapter 1 refers to it as clinical reasoning. So it's really the same thing. It's defined from your text. And I didn't include references, sorry, because I'm bringing things out of your text and you're going to read it very shortly yourself. Clinical reasoning is a context-dependent way of thinking and decision-making in professional practice to make practice decisions. So it does involve critical thinking in that we're looking at the context around the data that we're collecting and we're making decisions based on it that affect our practice of nursing care. Core dimensions of clinical thinking, and each of these dimensions is defined and discussed further in your first 3 chapters. Knowledge. What kind of knowledge level do you have? What's your brain like? Is your brain in good shape? Do you have good cognition? Not if you come to work with a hangover, right? You're not getting enough sleep, or you have a severe head cold. So cognition is also referred to as reflective inquiry. So in other words, reflecting. At the end of my clinical day, I say each day, especially when I'm learning on a new unit, it's like I'm starting all over again, according to Benner, as a novice. When I was working in the ER and fast track, I've never given injections to toddlers or catheterized newborn infants in my entire nursing career. And now all of a sudden I'm doing that. Or I might have a psychiatric case on an oncology unit and be taking care of bulimic. So I have to reflect, did I do the best that I could that day? What else could I have done better? And metacognition, which we'll define in a moment. So critical thinking is defined, is in professional practice. We do refer to critical thinking as well. And it's intimately linked to the process of reflection. Okay, so you don't just go through the motions, you reflect on what you did. And it's defined as the intellectually disciplined process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, and or evaluating information gathered from or generated by observation, experience, reflection, reasoning, or communication as a guide to belief and action. If you wrote this sentence, I'd make you split it up into 2 or 3 sentences. That's a long sentence, a long definition. So that's what critical thinking is. And actually, that's what I want you to do as you post your discussion board posts. And as you complete your paper, the greater degree of critical thinking that you demonstrate, the closer to 100% grade that you're going to receive. So this man here is doing some critical thinking. You can tell he's deep in thought. Ethical thinking. By the way, this is a picture of me and my mom. And I went through a lot of ethical thinking in taking care of both of my parents as they were on a downward spiral over the last 2 years in terms of their health. There's a point where you have an ethical dilemma. So the ethical dilemma is how aggressive, every time I took them to the physician, how aggressive should we be with managing this or that clinical problem? Because literally everything goes as you get older. So ethical thinking is defined as those less recognized but frequently made decisions regarding moral, political, and economic dilemmas, which clinicians regularly confront, such as deciding how long to treat. So, with my father in particular, he kept aspirating his food, and there really wasn't much we could do about it. And he had already had a long trail of intractable pain and didn't want to live any longer. And I had to make the decision to put him on comfort care. And 2 days after I made that decision, he was gone. So it became so stressful for me as a clinician and a daughter that I developed appendicitis and had to have emergency surgery. And unfortunately, that's the day I lost him. I didn't even get to see him pass. So you'll have lots of family members, especially with having more and more people age to the point where they're actually suffering. And I know many of you have seen people begging to die. And we insist on keeping them alive. So that would be a great example of an ethical dilemma that we wrestle with. Some of you are in ICU. You know, when you take away the dopamine drip or other medications, that person will not be able to sustain their own life without that medication. And that presents an ethical dilemma. We're doing ethical thinking all of the time, and it is another source of stress for nurses. So that's something to consider as well. Another part of thinking is creative thinking. This is a way of looking at problems or situations from a fresh perspective. And it suggests unorthodox solutions that perhaps no one else has even thought of before. And sometimes it's unsettling. For example, with our ethical problem of comfort care, maybe we should take patients off their medications completely at some point. If they want to die and they're ready to end their lives, why not? Now that's unsettling, isn't it? Because it's unorthodox and it's not something that we're doing regularly yet, but it's something that I would like to explore in terms of a researcher and move towards. I think when people are ready to die, we shouldn't be working so hard to keep them alive. So that involves some creative thinking, some ethical thinking. Creative thinking can be stimulated by different processes like brainstorming. Now, did you ever say, let's brainstorm about this for a minute? You just throw ideas out on the table, and then somebody says, why can't we do that? Why can't we start taking people off their medications if they're ready to die, for example? Now, some of you may object to that, but that's what makes it an ethical concern. So, there's something called lateral thinking that you'll explore more in this course as well. And I got this definition of creative thinking from this internet site that I've provided. And so that's something you can explore more if you like as well. So we are going to discuss too in another unit later in the course, decision making and problem solving, which in your text is called clinical reasoning. It's the same thing. Clinical reasoning has been defined as the practice of decision making. Addition dimensions impacting thinking and decision making include mutual decision making. So there's a great emphasis in your text on working with the client in making the decision. For example, the end of life decision that I brought up. Shouldn't the patient have some input into whether their life should be continued or not? So there's something called contextual, the context of the situation, a context, the interaction of everybody involved between the decision makers and also the environment. And task impact, or the influence of the nature of the clinical problems or the task on the reasoning process. And I thought of, there might be something that you have to, maybe you have a real problem with death, for example. You can't even think about dying. Okay, so that task of trying to determine whether to extend somebody's life or not may influence your reasoning process. So there may be times where you have to bow out of a decision-making process, but certainly as nurses, we don't have that choice a lot of the time. Okay, so metacognition. I used this term earlier. This is a term that's new to me as well. It's not something we use every day. It's referred to as reflective self-awareness. Interesting. We all know some people who are very not aware of themselves. It's important as nurses to be aware of ourselves so we know how we're impacting, especially our patients. But I know nurses who have no awareness whatsoever. Could tell you stories, they're funny. But anyhow, metacognition is seen as a bridge to, it actually bridges knowledge and cognition. So remember, knowledge can be acquired. It's what you acquired. All this knowledge that you're getting from your nursing classes, you have to do something with your noodle up here, your cognitive processes. So how does that get mixed together up here? That's metacognition. While I was in nursing school, I took a course on medical ethics outside of the nursing department, and also on death and dying. And those two courses, you see those as fluff courses, but they greatly influence how I am and my being as a nurse. I'm very concerned about suffering and death and dying and ethical issues. And that's because I've obtained that knowledge. It's interacted with my little noodle, my cognitive processes. And that's metacognition. So metacognition enables clinicians to identify limitations in the quality of information obtained. So there are times where you don't have high quality information. And through metacognition, you're able to determine, hey, I need to know, for example, how the patient and family feel about this. It's not enough to just know this and this. I need to know how they feel. So through metacognition, we can identify when our knowledge or skills are insufficient so that we can take appropriate action. So in this class, you'll see a lot of Patricia Benner's concepts. She is a nurse theorist who has dedicated much of her life to exploring thinking in nursing and how to cultivate sound thinking in practice, how to teach people how to think. And she wrote a document called Novice to Expert, Excellence and Power in Clinical Nursing Practice. She believed that expert nurses develop over time as they move through 5 levels of development. They start out as a novice, become an advanced beginner, eventually become confident, proficient, and then expert at what they do. So I'd like you to read a little bit about her this week, and the reason being is that much of the course is based on many of the concepts that she's invented. So nurse theorists are inventors of theories that help us to understand what we're seeing in life and what we're seeing in nursing. So on page 130 of your textbook, please read through that. I didn't assign it officially, but our authors of our text talk about Benner, and they've identified these concepts as being important concepts to understanding thinking, clinical thinking, and they're called reasoning and transition, skilled know-how, response-based practice, agency or moral agency. Really, that's our moral ethical reasoning, and perceptual acuity and skill of involvement in clinical. I'm not going to define all of these. You can go to page 130 and read about them yourself and learn a lot more than what I can impart here. So I just wanted to bring those up to you. I've assigned an article for you to read this first week. It's called From Novice to Expert to Mentor, Shaping the Future. And I like this article because it very succinctly describes Patricia Benner's theory, or parts of it. It's much more involved than what we have here in this article. But it also talks about how we need more mentors in nursing. And so that's why it's entitled From Novice to Expert to Mentor. So many of you are mentors in the clinical setting, and I imagine that you're experts in your area of clinical nursing practice. Now, Benner does say, well, we go back to a different type of nursing practice, like I did, going into the ER or oncology, that we become a novice all over again. And that's true. But we tend to move through these phases a little bit faster because of the other nursing knowledge that we have. So anyhow, it's a very short little article. In addition, in the article, they talk about as leaders, and it's the Robert Wood Johnson Nurse Fellows Program that identifies 5 core competencies of leaders. And the first one is self-knowledge. So I wanted to bring that up because you need to develop self-knowledge about your own thinking processes. And this is a part of becoming a nurse leader. And you're transitioning into greater leadership roles when you obtain greater levels of education. So please be open as you move through this course to self-knowledge, learning about your own thinking in particular. Other qualities include having vision. Now, what is your vision for yourself? What are your goals in obtaining this degree? What do you want to do with it? You are taking a risk in coming back to college. Hopefully you're, being creative and thinking about your own personal reward and what you hope to achieve, not just an increased salary, but a greater rewarding experience and becoming more knowledgeable. And a couple other factors are interpersonal communication effectiveness and inspiration. Being able to inspire yourself and also inspire others. That is the oxygen that feeds the flame, I must say. Okay. So finally, in conclusion, please read carefully chapters 1 to 3 of your book. You will use a lot of this content for your first writing assignment. So don't just read it, digest it. Make it a part of you. Please contact me. I have my email here if you have any questions whatsoever. And especially if there's technological problems with the course, I don't know if someone doesn't tell me. So if we will run into a problem, I'm sure, here or there. And when we do, I'll post an announcement readily on our course wall and I'll fix it. So if you're having problems, please let me know. Sometimes they're your problems, sometimes they're my problems. but it's great for me to be able to tell you, I think this is your problem and you need to call the technology help group because no one else has reported this so far. This week you're gonna post an introduction of yourself on the discussion board, and we'll just get to know each other. Let's have fun with this, okay? It's work, but we can have fun too. Learning should be fun, right? Okay, finally, I hope you enjoy this course, and I truly want you to be successful. If anything happens over the next 7 weeks that stands between you and success, please contact me right away and ask for an extension of any assignments that are being delayed. So, thank you, everyone. I look forward to meeting with you. Remember to flex your brain muscle. That's why I have this little, let's work out our brains, all right? Goodbye. See you next time.